fantastic your orientation program about the ethics in medicines. You might have a much better idea, especially if you continue your professional journey in the academic institute. So another aspects in this ethics in medicine is important, specifically continuity of from the previous talk. It is a monitoring in clinical studies and data safety monitoring board. Just want to ask a few things. Why you feel there is a need of monitoring in clinical studies? Anybody? Why there is an importance of monitoring in clinical studies? So, anyone want to say any few words or specific aspects? Why we need a monitoring? कुछ भी बोल दो.
Keep it more ethical.
More ethical. Okay, you are listening words ethical for last many days. So yes, okay. Answer is okay. Then any other aspects? Why you need? Protocol is adherence and anything? Safety of participants, side effects. Yes, very good. Yes. So I hope so after the 20 minutes, you will be clear why monitoring is needed for clinical studies and by whom it is being conducted and when and how frequently and how it is being done. So again, this aspect you might have on the second day of your course about the risk benefit assessment. So can anybody would like to give example where there you feel there is no risk at all in doing that particular study? Retrospective. So is it without any risk? Look, if you are resident and two residents want to work on the same area, retrospective data collection and want to analyze. So possibility there will be disharmony among yourself itself by doing so it is not harm to the participant, but among the researcher, there will be some issues. So there is, in fact, no studies is without any risk. Every research has some inherent risk and probabilities of harm or inconvenience to participant or communities at large. So this is words from that ICMR booklet, guidelines about bioethics, published in 2017. So there are the various type of risks to the research participants. Not for the researchers, but research participants. It's not physical harm, but other harm also that include the psychological, social harm, economical harm, privacy related risk, breach of confidentiality related risk. If someone want to do like a survey among yourself, among the residents, so if there is a column about the which department, male, female, or some mobile number or contact number, you feel there is a probability of breach of confidentiality or the privacy related risk. So there is always an inherent risk in any kind of studies. This also has been covered. Just quickly review the categories of the risk you have to take while you are applying for ethics approval for any of your studies. So one is that less than minimal risk. Second one is the minimal risk. Third one is that minor increase over minimal risk or called as a low risk. Fourth is a more than minimal risk or high risk. So here the last one comes the international studies. Less than minimal risk, where the probability of harm or discomfort anticipated in the research is nil or not expected by you, like doing the meta-analysis or analyzing the data available in the public domain. So it's called as an office desk kind of the research. everything is available in public domain or available in the kind of doing the meta-analysis. So those kind of the research are considered as less than minimal risk. Second one is a minimal risk, where probability or of harm or discomfort anticipated in the research is not greater than that ordinarily encountered in routine daily life activities of any average healthy individuals or general population or during the performance of routine test. So like in the clinical management, you say it's observational studies. So, but if it is a for your studies, you are not doing extra a specific questionnaire or specific for extra blood collection or anything. But few things are granted in this minimal risk, like obtaining body fluids without invasive intervention, such as hair, saliva, urine sample, or patient might having already some drains or some tubes are there. You collected the sample from there. So for your studies, you are not doing any intervention, not doing any discomfort to the patients. Then it comes under the minimal risk. Minor increase over minimal risk or low risk, where increment in probability of harm or discomfort is only a little more than that minimal risk thresholds. So either the group is just slightly different from the adult population, like the vulnerable population, like children, adolescent, pregnant women, or the kind of the studies which involve the sampling, needling to the patient, where you won't collect the blood for your study, then it will come under this category, minor increase over minimal risk or low risk. More than minimal risk or high risk, where the probability of harm or discomfort anticipated in the research is invasive and greater than minimal risk. Means any kind of international studies come in this category, considered as a high risk. So what is the purpose? As you already enumerated few of them. So the experts in this clinical trial monitoring, the experts in this field only, so they come out, they look the 13 the experts in this field in the monitoring of clinical trials, they come out, they frame and they identify the 5 purposes published in 2022, last year only in the trials journal. So the purpose is clinical trial monitoring is keeping participants safe and respecting their rights. What you had learned last few days. Safety of participants and their rights. Not only that, they think beyond this, monitoring is required for the generating data where the scientific community, the human beings, they can trust your data. Making sure that trial is run as it was meant to be, improving the way the trial is run, preventing problems before they happen. So these are the purposes of the clinical trial monitoring. And by whom it should be done and when it has to be done. The ICMR 2017 guidelines, they say even you get approval of your any studies what you had submitted for your projects, they say submit the report annually, report of progress of your ongoing studies. So at least once a year or more frequent can be asked by the ethics committee. How many numbers you had recruited, is there any violation, any problems happen in that on. Even for observational studies, they ask for the progress report at least a yearly basis. For international studies, they are asking, ethics committee are asking if you have any protocol deviation, violation, or non-compliance. Means researchers has to find it out when there is a deviation violation. So they have to report the ethics committee. And serious adverse event also to be reported. So you see that these are the for international studies, you have to report SAE. So researcher is expected to submit report within 24 hours to for two places, means they have to submit their institutional ethics committee and they have to send the information to the regulators, central regulator like DCGI. And ethics committees also has a responsibility to send the detailed report to the regulator. So within 24 hours, it has to be done by the researcher, and detailed report within 2 weeks has to be submitted to both ethics committee and regulator. But ethics committee has a major role in this all the reporting system, because ethics committee has to sure that researchers is reporting all SAE. Ethics committee also has to submit to regulator their individual independent report. There is a subcommittee of SAE among the ethics committee members. So I hope so this is a clear, because it is an important aspect while you are going for any international studies or trial. SAE might be on-site or off-site. Like if any interventional drug, your participant has been died at home, still you have to report. If patient is in the follow-up period, patient died in the accident also, road traffic accident, you have to report, because you never know that particular drug has impact on the sleep pattern that lead to the some road traffic accident. How you know? So all the things on site and off site. On site means during the hospitalization, off site means not in hospital, has to be reported. That is a different that detailed association of that particular intervention and association of that serious adverse event is there or not. That is different, but has to be reported. Other than ethics committee, who else are monitoring in the clinical studies? Basically all interventional studies. So as the previous talk, you had heard about data safety monitoring board. So it's not it's not mandated till now in Indian scenario, but better if some institute has a DSMB. It has independent than ethics committee. It is separate than ethics committee. Who else is monitoring during the clinical trial? Sponsor, of course. Sponsor also independently monitor all the centers where the side effects is being more or not, violation of the any protocol has been done or not, adherence to that there or not. And of course, the government regulator also has to be monitored. So these are the four bodies actually, they are considered to monitor from different angles. Everyone has a different power and different roles. Ethics committee can monitor your study as a routine or for cause. For cause means something has triggered, like researcher is sending more high number of protocol violation or deviation related information, then ethics committee member has to look in that why it is happening. So other reasons might be large number of SAE report from your center, then ethics committee is triggered to look in the matter. Is it the same thing is happening on the other centers or not? Why is it happening to our center only? Large number of proposals carried out means recruitment is a very high number, because the sponsor might give the some money incentive to the researcher. So you are recruiting higher number. So is it justify? Other center might be having struggling to recruit 4, 5. Here we are recruiting the 50, 60 in your center. So they have to look. There must be some rationale. Either your hospital is bigger, your footfall of that particular patient is higher, but there must be justification for that. They can look for that. So compliance received, any complaints received from the patients directly to the ethics committee, you must have gone through the exercise in your patient information sheet or document, where you see that you write the name of the student or guide or main principal investigator, along with that name and address and the contact number of the member secretary. So why it is so? Because the participant can reach directly to that for any complaint. Participant can afraid to complain to their treating team, but can reach directly to the member secretary of ethics committee. That's why it is a mandatory to mention in the patient information document. Any kind of the media reports, so it can trigger to look by the ethics committee in that matter. So actually what is happening? So one recent survey done in the United Kingdom. So monitoring in practice, how are UK academic clinical trials monitored? So they contacted 50 registered clinical trials unit in their country. Out of them, 43 responded. So these clinical trial units registered and approved for the cancer trial in 30, with 24-hour randomization approval in 38, and with international trials in 29. So these are the characteristics of that clinical trial units. So why the actually on-site monitoring done? So that was the purpose of this survey. So you see, it is not a serious adverse event. It is a because of number of protocol deviation and violation, consent related issues, number of unanswered queries, suspected fraud, and adverse event. These are the major things where these things triggered actually for on-site monitoring by Data and Safety Board monitoring. So few words about, you should be aware about Data and Safety Monitoring Board. This is an independent group of experts. It is not related to the ethics. The three important group of the members. One is the expert in that clinical aspects, means clinical expert in that particular study, biostatistician and researchers who know about how the clinical trial being conducted and methodological aspects. So these are the types of the members in this monitoring board. So their responsibility to look, other than ethics committee, they have to look independently the study related adverse event, evidence of efficacy, data quality which are being generated during the trial, adequacy of compliance, adherence to the protocol, confidentiality of the trial data, and participant safety or the ethics related issues in the study. They have a more teeth actually in comparison to your ethics committee, institutional ethics committee. This data safety monitoring board can modify your study protocol during ongoing study. They can suspend, they can stop ongoing trial if they find it out either there is a harm because of your intervention. So they have a more power actually. So that's why previous in talk it was said, if you have a data safety monitoring board in any clinical trial, so there is more chances of getting accepted in the good journal, because authenticity of clinical trial, quality of the clinical trial is much higher if your clinical trial is being monitored by this committee. So in the summary, I will say that monitoring is more required, and it is a mandatory for the clinical trials, means international studies. Purpose, participant safety, it is a one. The second more important is your safety, researcher safety. And in the long run, you have to generate the trustworthy evidence. And definitely, ultimately goal is the benefit to the human beings. It is being monitored by that ethics committee, sponsor, regulator, data safety monitoring board, and can be monitored as a routine or as a on the triggered base, means particular regions if it is arise during the clinical trial. Thank you. I hope so I had a clear some given the overview about the monitoring in clinical studies. Any doubt, questions can ask.
How many of you have been allotted topics for your project? Research projects? Anybody is doing something related to data? No one has been allotted topics, you know? Everyone is looking down. Second year, no?
I hope so all of you submitted your projects to the ethics committee by now. How many had not submitted? Just raise your hand. Okay, 3, 4, 5, 6 people has not submitted.